Maskne, what exactly are we talking about? Is it just an irritation that's caused by wearing the mask all the time?
So yes, maskne is acne in the distribution of your mask. You often see it around the line of the mask. And clinically, we call this acne mechanica because just as you said, it's caused by that friction. That friction causes irritation and inflammation of the follicles, and that can lead to an acne cyst. And you can imagine the combination of that with the oil, dirt, and debris in our skin is the perfect setup for a really robust acne breakout. Further, the environment underneath our mask is very humid. So if you consider the vapors from breathing and talking, and this constant moisture can also cause irritation, inflammation, and ultimately skin breakdown. So how do we prevent against both of these things? It's really all about excellent skincare and gentle skincare. When we have acne, our tendency is to want to do something really aggressive. In this case, we do not want to do that. The skin is inflamed. So it's all about gentle skincare, building up your moisture barrier to really help to prevent against both of these problems.
Oh, wow. Okay. Mechanica? Acne mechanica? What did I hear in there?
Acne mechanica is
Acne
the medical
mechanica.
term.
All right. Well, we have a viewer here who needs some help. This is Amy. Let's listen to her question.
Hi, my name is Amy St. Peter. I am from Bangor, Maine. I am a physical therapist. Prior to the pandemic, I had occasional breakouts, probably hormonally related, along my jawline. Since the pandemic, I have been having to wear a surgical mask for 8 to 9 hours out of my day, and I've noticed that my skin seems to be breaking out even more along my chin, sometimes under my eyes. I'm looking for some help on what I can do to make this go away. It is quite painful. It's woken me up in the night because I can feel it under my skin. The problem seems to be getting worse. Whatever I try to help isn't seeming to help make it go away. So my question is there something out there that you can recommend to help me clear up my skin issues?
Okay, Dr. Henry, help her out here. And you know what? That's a good point she makes. This is not just a cosmetic or vanity issue. She said it's quite painful. So what do you recommend for her?
So absolutely. So that friction can cause not only superficial blackheads and whiteheads, but also deep painful cysts. And I see this a lot in a lot of the essential healthcare workers that I care for. So what I recommend is really 5 simple steps. So the first, gentle cleanser. So we want to cleanse the skin, but again, we don't want to strip the skin of moisture because that moisture barrier is important to prevent against friction and inflammation. The second step is if you're using a toner, use a gentle toner. So a toner with light ingredients, so low concentrations of lactic acid, glycolic acid, salicylic acid, will help to unclog those pores gently without drying the skin. So avoid harsh toners with ingredients like witch hazel, which can be really, really harsh on the skin. The third, and probably the most critical of all the steps, is invest in a good moisturizer. So again, we want to create that moisture barrier to protect the skin from that friction. So look for ingredients like hyaluronic acid, ceramides. Those are going to waterproof the skin and keep the bad things out and the good things inside and make our skin stronger. The fourth step is to don't forget your SPF. So A, I want you to always protect your skin against skin cancer because the masks do not provide perfect protection. B, no one wants an unsightly mask tan. But C, if you are to burn, that can worsen your acne and worsen the inflammation. And then the last step is if you're still getting acne after using this good, gentle skincare regimen, then you can adopt some traditional acne creams. But again, stick to low concentrations. So low concentrations of salicylic acid, low concentrations of benzoyl peroxide. Those are easy to get over the counter at a good price point. Make sure everything you're using does not clog your pores. So look for the word non-comedogenic, and that really should help you in the long term.
Oh, my goodness. And you know what? We are going to be talking about this for a while because these masks, these face coverings are going to be with us, it seems, for a while. So this is something, hopefully we can have you back and give us some reminders and some updates. But Dr. Henry, thank you so much for